Hey everyone, welcome back to the Home Care Strategy Lab. It's your host, Miriam Allred. It's great to be back with you. I hope everyone's having a great week. Today in the lab, I am joined by Brendan Mullins, the CRO of Vitable Health. Brendan, welcome to the show.
Thank you for having me. It's great to be here.
It's great to have you. I'm excited for this conversation. I told you I interviewed Joe last year, but it's been a while, and this topic is super important. And it's one of those things that I don't think enough people are thinking about, let alone talking about. And in this AI world, I want to, I guess, just praise you guys in building something really tangible, meaningful, kind of basic or essential in the best way. And so I like to kind of surface these conversations when I think everyone's kind of tapped out of AI. Not saying you're not using AI, you probably are, but something a little more like hands-on and tangible. So excited to have this conversation.
Me too. Thank you.
Let's start with your background. Tell everyone a little bit about yourself and then do kind of a quick intro of Vitable as well.
Yeah, sure. So I'm Brendan Mullins. Like you said, I am the CRO at Vitable Health. I've been here just about 2 years. I have been in the health and benefits industry for the last 20, working for a lot of probably the big brand names that you've heard, and came to Vitable because I just got tired of like selling a thing and really wanted to do something different and actually help people. And for me, knowing this industry as well as I do, it's very tough to negotiate. It's very tough to navigate. Um, and often you don't feel like you're actually helping people, even though you might have set out to do that. So for me, Vitable was a really strong choice because I think we have the best mission. And I think we are really focused on, actually doing something good for people. Personally, grew up in New York, live in San Francisco. I always say I have that, cold, dark heart of a New Yorker inside, but I present in a very fluffy and warm exterior. But I've been very fortunate to have almost about 25 years in both. So it really, I think, big part of me, but love living in the Bay Area now, which is where I'm at. So
Amazing.
yeah.
Amazing. And 2 years at Vitable, give everyone just kind of a teaser of Vitable and then we'll talk more about it at the end.
Yeah, so Vitable helps employers offer affordable healthcare benefits, especially to hourly workers, where they might have trouble, affording the company health plan, and maybe they're stuck in this limbo where they almost make a little too much to go get government assistance. And so we offer a wide variety of different healthcare benefits that are tapered to that sect of people, and we combine primary care with preventative care, and offer ACA compliant health plans.
Amazing. Let's start by talking about ACA compliance. I
Sure.
hope
Favorite.
us talking about this, it's not anything new to anyone listening to this, but I want to just kind of like set the record straight and give everyone just like a quick refresher. Um, Give us kind of a brief background of the ACA Affordable Care Act in
For
a nutshell.
sure. Yeah, my favorite topic, and it's so funny. I'll start, Miriam, by saying that I was on a call with a customer yesterday, and I said, "We can go as deep as you want to go, right? We could start off here, but with the ACA, there is always another but or another and or another thing that we can talk about and add on because it can get very complicated." ACA, you said, "Hey, most people are aware of this." Shockingly, a lot are not. So we work with, hundreds and hundreds of home care agencies, and often a lot of people don't understand ACA and what they have to do to be compliant, or, are required to provide healthcare and don't. So, broad overview, the Affordable Care Act, or as many people know it as Obamacare, was passed in 2010. And this was, passed with the goal of expanding healthcare to really everybody. And at the time that came out, there was an employer mandate where it said, hey, if you have over a certain amount of full-time equivalents, you will have to provide health insurance. And at the time, which is no longer active, it said, if you are an individual and you don't have health insurance, you're going to be fined at the end of the year. That piece eventually was repealed, except in a few states, I think like Vermont and one or two others, maybe DC. But today, as it stands, there is now only that employer mandate where if you are an employer and you have more than 50 full-time equivalent employees, we could talk about what that definition means, you have to supply healthcare. That's the very base level. We can go deeper from there, but that's where we are today.
And you mentioned that there's a lot of layers. This was back in 2010 when this is passed.
Yeah.
Like any legislature, there's just like iterations and layers and changes. Do you feel like it's still relatively similar at its core to what it was, or it's changed drastically and is basically something entirely differently today?
The biggest change is that individual mandate went away. So, technically, if you don't have health insurance as an individual, you are breaking the law. However, there's no more fine associated with it. And so that really is what changed it, I would say overall. Now, in the last, I would say a couple of years, there's been a lot of uncertainty what'll happen with it. And we saw as we were heading into 2026 with the one big beautiful bill, there was a lot of talk about, hey, what's going to happen? Are they going to cut the subsidies that those plans were offering in the marketplaces? Will it go away entirely? Will it shift to different products or try to push people into different new parts of healthcare product? And in reality, what we saw was not a tremendous amount of change. I would say that, if anything with current administration, this is the administration that would try to dismantle it the most, and we still haven't seen much dismantling of it. Um, I think what they see is there's a lot of usage of the ACA. And because of that, there's really not many administrations that want to touch it at this point because so many people are getting healthcare through it.
Okay, that's what I was gonna say. We're halfway through 2026 and nothing major has changed, so it's likely here to stay?
I think it's here to stay. It's changed a little bit over time, and I would expect it to continue to iterate. But as far as right now, if we haven't seen massive changes today, I would be shocked if we see something over these next couple of years. Honestly,
Okay, and it was interesting to hear you say it's not uncommon for employers not to know about this. Why is that? Why don't people know about it?
Miriam, I don't know. It's 16 years of being out there. And I think everybody, when you say the term Obamacare, everybody knows, oh, yeah, that's healthcare out there that I've got to get. But when we talk to home care agencies, at the end of the day, a lot of them aren't aware. And I think here's the deal. A lot of home care agency owners don't get into home care because they want to go learn every detail about healthcare. They get into it because they want to help people or they want to, go into a business that makes a lot of sense for them or, fits their lifestyle or whatever it is. When they get into it, they're not handed this big book of here's all the regulation that you need to go through. And I think because of that, they sometimes just don't know, but it's a lot more common than you would think.
Yeah, and even if they are handed a big book of regulation, they're not reading it.
Right.
Like, not to knock on anyone. It's just
Oh,
there's other like you said, there's other priorities, there's other focus, there's a reason why they're getting into this
sure.
business and it's not for this. But
Yes.
also hence why we're having this conversation. It is extremely important and it needs to be understood. And that's why I want to kind of like beat this drum of like everyone needs
Yes.
to
Yes.
understand. So we're gonna get into the details of how to calculate this, what to do,
Yep.
what the audit
Yep.
looks like, all of that. But let's just start with you kind of reiterating what is required of employers under ACA. What do they have to offer? What do they have to do?
Yeah. So let's start with 50 full-time equivalents is the number that you have to have in your head. And so a lot of home care agency owners will say, oh, okay, well, I don't have 50 full-time employees. I've only got 30 and the rest are all part-time. But the key word there is equivalence, right? And so the government isn't looking at your full-time. What they're doing is they're taking all of your full-time employees, they're counting them, and then they're looking at a calculation of all of the hours that your part-time employees are working, totaling that up, putting them together and saying, okay, you are or are not over that 50. And so if you fall in the threshold where now you have 50 full-time employees, you have to do two things. You have to go offer health insurance, and that health insurance has to fit in the guidelines and have the criteria that the government has outlined. That is usually tied to a certain metal level plan, which is usually like the lowest silver plan in your area is what you can offer. Um, and then second, you have to make it affordable for them. And so, you could say, hey, what does affordable mean? Well, it's actually outlined. So this year in 2026, it's 9.96% is the number. You cannot offer them a healthcare plan that costs them more than 9.96% of their overall pay. So if the plan that you offer is more expensive than that, you actually have to subsidize it for them. And so those are the two different parts of the legislation, and there's different fines and penalties for both. Does that make sense?
Yes. Okay,
Yeah.
let's talk about both. This is super interesting. I
Yeah.
love this.
Yeah.
Okay, let's give a tangible example of an agency that has about 100 employees and that's going to be mixed full-time, part-time. Can you kind of walk through the math of an agency? 100 employees, we're looking at the numbers vary, but like a $2 to $5 million agency can be in that like 100 employee range.
Sure.
Talk
Yeah.
about how they would calculate it for 100 employees that are, again, full-time and part-time mix.
For sure. And this is, before when I was talking about we can keep going and going, I always try to explain this without like drowning people in the knowledge because eventually you walk away and they're just looking at you like just kind of scared at a certain point. So I'll try to make it as clear and as simple as possible. So in that case, let's say you have 100 employees. Let's say 20 of them are full-time, and full-time is not 40 hours a week. It's 30 hours a week. That's what they count. So it's 30 hours a week is what's considered full-time. And so you take those 20 that you already know are full-time, and we're going to put them in one bucket. And then for those other 80 that are part-time, you're going to take all of the hours that they worked in a month. If anybody is working over 120 hours in a month, you're going to cap that number at 120. You add it all up and you divide it by 120. That 120 is 30 hours a week over 4 weeks. Whatever that number turns into, then you are going to add that to your full-time employee count. So maybe after that calculation, what you realize is, okay, this equated to 30 employees. I put that on top of the 20 full-time I have. Guess what? I'm now an applicable large employer because I have 50 full-time equivalents. Does that make sense?
That's perfect. That's perfect.
Okay.
That's simple
Good.
math that everyone listening to this can do. Are people relying on payroll software or HR software, or is there anywhere that's calculating this for them, or it has to be a manual calculation?
So actually, we will do that for you. There are a lot of people use payroll companies to do that. I've seen spreadsheets. I've seen them doing it manually. The biggest, unfortunately, the biggest thing that we see is they just don't calculate it correctly. And so if you are not setting that up with your payroll company, or you don't have some other, software or something to do it, 9 times out of 10, it's probably not right because, again, the different levels of depth, yes, you have to calculate that, but there's also something we call a look back period, where in your business, you're going to set up a look back period, typically anywhere from 3 to 12 months. And that's the period you're going to look back to see who qualified for that healthcare and who, ended up being a full-time equivalent. And so if you can't track the hours in that look back period correctly, you run the risk of not offering the right people healthcare, which means that you're at risk for a fine. So it gets, again, a little bit more complicated.
So when you say a 3 to 12 month look back, what should they use? Should they use the 3 to 12 month, or what number should they pull?
This is where I'm always conflicted
Okay.
because I'll tell you why. We run into so many different home care agencies with so many different situations, and the reasons why they want to offer healthcare varies. One of the biggest reasons is they have to, right? They just want to be compliant. But we also know sometimes that home care agencies are running on smaller margins and they can't necessarily afford to start going out and putting, all of these people into healthcare plans. And they might run a 12-month look back because for that first 12 months, they technically would not have to offer the healthcare if they have somebody that, is part-time and they are probably not eligible. At the 12-month mark, they would go back and look and say, did they work enough hours? And then they would be required to offer them healthcare because they qualified during that look back period. Why home care agencies do this is because if they are really thin margin, they know that there's a tremendous amount of turnover in the industry and a lot of people won't last a year. So what they're doing is really ending up offering the healthcare to the people that are staying and they want to keep. The second angle on this is we run into a lot of home care agencies that really, might have the ability to offer healthcare and they want to do the right thing for the employees. They also might be in a really competitive environment where they're trying to recruit people, they're trying to retain them, and they know that, one of their caregivers might go across the street for, who knows, a little bit more in their paycheck or an extra benefit. That's where they're probably going to offer a much shorter look back period, maybe a month, where we're going to look back, see if you ran the hours, and then quickly provide you healthcare so that, we're kind of locking you down and making you feel like we've really given you some kind of great benefit. So it's
Okay.
it's really about individual situations, I would say.
Got it. Okay. This is getting a
Uh,
tad hairy, but this is good.
yes,
Um,
yes.
when does the IRS come knocking and do they decide the look back?
So, no, you will state the look back. You will set up that, for your own and go back and look through that period. The IRS comes knocking, I would say at all different times, as
Okay.
the IRS likes to do. What I would say is, even if you think you're out of the woods, you might not be out of the woods. And all of a sudden, you're going to get a letter from 2022, right? Where you're just like, oh my gosh, I thought this was already done. No, they are just catching up to, the year that, they sent you the letter for. What I know is the IRS has gone through, reductions in staff related to, basic like processing. Where they've added staff is in areas where they can collect fee revenue or fine revenue. And so in areas like this where they can go and, create fines, or another big one is like the 1099 versus W-2. If you've misclassified that, it's another one. For a while they were putting a lot more inspectors into. What they're doing is obviously employing people where they can go find money. In this case, we're seeing more fines, I would say, over the last couple of years because of that, but also because the technology is so much better.
Mhm.
And so it's a lot easier for them to figure out, if you didn't supply healthcare. And the biggest way that's going to show up is if you are not offering healthcare and one of your employees goes to the exchange to get healthcare when you should be offering it. It's going to trigger an investigation. They will go back and look and say, okay, why is this person, coming to us to get a healthcare plan or a subsidy? And we need to go and look at that business. And that's where all of a sudden they start coming knocking.
Got it. Okay. Wow. I think like to these home care leaders listening to this, like sleep with one eye open. But oh, what a ball of stress to think that like they could come at you today for something years in the past. Like, oh my gosh, that's such a nightmare. Okay,
Yeah.
but that was perfect. I wanted to know what the triggers are. So if one of your employees goes out to the exchange, boom, red flag goes up. Are there any other kind of common red flags that employers should just be aware of?
Uh, no, and I can explain, a little bit of the difference on the different fines because I think it's important to know. But the biggest one is them going and getting, their own plan. But they will
Okay.
just also audit businesses for what they think are probably clear applicable large employers that have not reported that they have healthcare.
Okay,
Yeah.
which is why a lot of these probably $2 to $5 million businesses just think they're flying under the radar and it's worth the risk and the IRS hasn't come knocking yet, therefore they're not doing anything, and that's
Yes.
the trap, and it's like,
Yes.
avoid that at all costs. I was gonna ask about, like, filing your taxes, when these companies file taxes, I feel like there's usually reporting around health insurance and benefits and all of that, like, is the IRS also keeping a close eye on, like, the taxes and the tax reporting, and this is where that could show up, or am I wrong?
So they have to file a 1094 and a 1095. I don't see as much related to that, but I wouldn't be surprised if they look at that. Kind of like I was saying, if they can understand that the business has X amount in revenue, they probably need a certain amount of people. They can make that connection, and maybe that's one of the ways they would dive in, but I just can't confirm it.
Okay, that's fine. Just was curious if that was kind of another trigger, but it sounds like people going out to the exchange. And so that's definitely something that employers can be aware of. Again, employees can go out and do whatever they want, and employers may or may not know if they're doing that, but that seems like one that they could identify if they tried.
Right. And they can't discourage them from doing it if they're not supplying health insurance. But I will say, and something you just said made me think of this, the sleeping with one eye open, we also see a lot of employers that I think have sold themselves that they're doing something that qualifies when they're not. And probably the biggest one is they will interpret the law as, okay, I have to offer healthcare. And we'll hear them say, well, hey, I went around and I offered it to all my people and they didn't want it. And it's not like walking around and just auditing the team and saying, "Hey, would you guys like healthcare someday?" They're going to say, "Ah, no, I'm good." You literally have to go buy a plan, put it together, offer it to them, and show proof of that. Going and just saying, "Hey, do you guys want this? Doesn't work." And the other thing that doesn't work is, "Hey, I put a little bit more money in their paycheck for it so that they can go buy it on their own." Doesn't work.
I think you just caught a lot of people red handed
Well, yeah, and then, like I
because
said,
most people are doing one of those things. And I have heard that out of people's mouths.
yeah, and they have convinced themselves that they're going to be fine. And guess what? When that fine comes, it's worse because maybe you have been putting more money in people's paycheck. And not only are you going to pay that, but you're going to go pay that fine as well, which is just, double whammy there. So
Yeah. Okay. So we're going to get back to this, like what employers should be doing. But I want to circle back to this has to be affordable. What you're offering them has to be affordable. That's the purpose of this. And that's also like the linchpin. And you said that 9.96% of their income. So
yeah,
that is a threshold that the IRS has given us, and that's probably also a common pitfall of where employers are thinking, "Oh, we're offering them something, but it's not good enough," and it's not actually meeting the threshold. So a lot of people could be out there offering things that actually just don't comply.
I've seen that too. Right. And you do have to ask the right questions. I've seen people that have been sold into plans from other healthcare companies or insurance brokers that don't fit the qualification and they think they're covered, but it doesn't. And I've seen them set it up in ways where, it doesn't qualify. And I've seen them pay. We were talking before about calculating the hours. I've seen them pay for services where it calculates the hours, but it's wrong. And so it's unfortunate. It's very confusing for like the business owner.
Yeah, well, and there's a lot of complexity to that. I'm just thinking in my head of the 9% multiplied by every single employee and doing that math. It's like I read somewhere else, the plan must cover about like 60% of their expected healthcare costs.
Yeah.
Is
Yeah.
that, I don't know if that 60% is a generic number or a hard number, but something about it covering like a good portion of their anticipated healthcare costs.
Yeah, exactly. There are like the rules on what the plan has to offer are pretty laid out. And, I said it before, but a little bit more explanation. Most healthcare plans are rated like bronze, platinum, gold, silver. And that 60%, when you have a silver plan, it almost equates exactly to that. And so, what the minimum plan you can usually offer in a market is that lowest cost silver plan in the market that's available, and that will cover 60% and will qualify for ACA compliance.
Okay, that's a great nugget.
Exactly.
Everyone's seen those different tiers and it's to me it's just ambiguous. Like obviously platinum and gold, in my mind I'm like,
Right.
"Oh, it's just like a ranking system," but actually it's based off of like anticipated healthcare costs. That's really good to know. And the silver is like the bar.
Yeah, yeah. It's not tied directly to the anticipated healthcare costs, but it's a good equivalent, I would say.
Okay.
Yeah.
Okay. I don't wanna lean too much into the scare tactics, but I want to really make sure we also nail the penalties because this is no joke. Like, this is people should not be messing around with this because these penalties are steep, and so can you reiterate the different penalties and what those triggers are for these penalties?
Okay, so you have two parts. So there's part A, and this is you have to supply healthcare. And this is the big fine. Okay. So if they figure out that you aren't supplying healthcare, they're going to look at the entire population of people that should have been supplied healthcare, and they will fine you based on the amount of employees that you have in that. The fine, off the top of my head, it changes every year. I believe right now it's about $3,340 per head. So let's say in the case that you've got, 100 people that should have been offered healthcare, you're going to go and do what, 300,000 some odd dollars in fines. Now, they do give you one break, which is the first 30 people aren't going to count. So they will waive the first 30. And in that scenario, you would be on the hook for that remainder 70 times the 3340, so 210-ish thousand dollars. Okay. This is a big fine. This is a fine that we've seen put people out of business. This is a fine that, is just not the surprise you want to have. And keep in mind, if you're just receiving that letter from 2022, there might be a letter from 23, 24, 25 coming as well.
For sure.
Um, and what we've seen, and I can never guarantee anything, or I would never say, this would happen to you, is usually that first fine, you can work with the IRS and negotiate something down, or, maybe get it to a place where it's really minimal. However, it's not going to happen a second time. So at that point, if you were able to do that, you probably are now raising more flags to make sure that they're checking in every year after that. So that's fine one. Fine two is a much I don't want to say much better. We call we call part A the sledgehammer fine, right? That's very painful. Part B is they will fine you $5,010 for any employee. This is sorry. They will fine you $5,010 if you have not made it affordable, and that's that 9.96. But the way they will do it is based on any employee that goes to the healthcare exchange to get their own plan. So they will not look at that one employee and then go back and do all the employees. They will only charge you for that one employee that went to the exchange. So, again, I can never give you financial or advice or healthcare advice, but what we see with some home care agencies is they will take the risk on that second fine because the level of plan that they might need to go and provide or the dollars that they might have to subsidize for that employee might outweigh the fines that they think they're going to get. So it might actually be more expensive for them to go supply a plan than to just roll the dice and not be covered for them. Does that make sense?
Okay, very well said. Yeah, I just wanna lay out both of those 2 penalties so people
Yeah,
understand those,
yeah.
like, crystal clear. My question is on the latter.
Yes.
What is your recommendation for employers to prevent employees from going to the exchange? Is that something in the handbook, something explicit in onboarding? How do you
Yeah.
prevent that?
I don't, to be real, I don't think you should, right? Because I
Okay.
think that probably creates more problems for you because it's their right to go to the healthcare exchange if you're not supplying healthcare. Um, so, I mean, stopping them might actually cause more issues for you than not. Now, I know a lot of companies will educate people about the exchange and what they're going to get. But honestly, the best thing to do is provide them healthcare so you don't have to worry about it. But yeah, I mean, there's a lot of complexity to it for sure. So
Okay. And
yeah.
that's what I wanna kinda talk about, the complexity for home care. Like,
Mhm.
why we both know this, but I want you to kinda state, like, why this is more difficult for home care agencies to stay compliant with ACA than it is, like, any other business in any other industry. Like, it really home care is so unique and that this is so complex for home care.
It really is. It's really brutal, and I empathize a lot with the home care agencies owners that we work with because it's so tough. And the big reasons are you have a I don't know, you have an accounting firm with 50 people that work there and you're an applicable large employer. Well, guess what? They all clock in the same time every day. They're all working the same hours. They all are getting the same kind of healthcare. That's pretty easy to figure out. Problem with home cares, as everybody knows, is often you might have 100% turnover. You might have people doing a ton of overtime here, somebody calling out for shifts here. You are constantly triggering schedules. You are all across the board, and then somebody comes to you and says, "Hey, how many hours did all these people, the part timers, work last month?" You're like, I don't
Good
know, and
question.
who qualified for healthcare, and and so that's one part of it is just the turnover and the hours make it really hard. The other part is that, like I said before, they will go if they will go for small things, right? They will go and shift companies or go do something else if they can get a little bit more money. So it makes it very complicated beyond the fact that, from what I've seen, home care agency owners are taxed, right? They are usually in the trenches. They are trying to keep some semblance of a calendar. They are running around trying to staff, trying to like all these different things. And then to try to go and like calculate all this stuff and do it correctly, it's impossible. It really is.
And I made the comment about AI at the beginning, but I reiterate that here. I think a lot of businesses of every size are focused on kind of the flashy net new thing. When I
Mhm.
talk about insurance and benefits and these types of topics, it's like they're unsexy and they're, quote unquote boring, but like these are the essentials that can
Yes.
make or break your business. And I just kind of, reiterate that and put in that plug of like, make sure you're focused on the most important things and not be wasting time or attention on kind of net new things that granted can help your business. Absolutely. And I talk about those things and I love those things myself, but not to lose sight of the most important things, and this being one of them.
Absolutely. It's so funny. I was at a conference for home care agencies last year, and it was a really nice one. They had like a sponsored happy hour, sponsored dinner, sponsored shows, and every single one of them was an AI scheduler was sponsoring the event. And I'm like, oh my gosh, like how many of these are there? And it's great. Like you need that in home care, but don't forget, like your top two expenses are probably payroll. And then, maybe it's not two, but in there is probably going to be healthcare in the top, 3 to 5. If you can figure that out, you can really help the business. And if you look at, one of the things, if people have Medicare funding back to them, if they're dependent on that, if you look at what has happened over the last, let's say, 10 years with reimbursement and compare it to caregiver wages has continued to shoot up, and that reimbursement has stayed completely flat. And so it's eating up more and more and more of the margin. And if you don't address it, that healthcare is really going to become a massive problem for you.
And that's another back to the last question of like why is it so complicated for home care? The margins themselves. There's not additional money just laying around these home care companies. And so they squeak by not offering health insurance as long as possible because margins
Mhm.
are tight and there's not just
Super tight.
cash
Yes.
dispendable for this.
Not at all. Yes. Yes.
Let's talk about the audit process because again, this is maybe this is a two-parter like what agencies can do to audit themselves and how they should go about that, and then I guess the formal audit process with the IRS. How do you want to tackle this? Kind of like an internal self audit or the IRS's audit process, and is that helpful?
Yeah, I think I can talk a little bit about internally what you can do. I think on the IRS, I can't speak for them exactly like how they go through everything, but we could talk a little bit about it. I think usually, internally, the best things that you can do. One, if you're offering health insurance, is obviously to have all the documentation and do your end of year filings, but also have that look back period set up so you can point at it and say, we offer it in 3, 6, 9 months, whatever it is. But then also create an eligibility policy in the business for who's available for what business. And that's usually triggered by how long they've been working there and how many hours they put in. And then I would say, make sure you keep a record of everybody that declines that health insurance. Okay, because they're going to want that when they come in. From the look back period, you know, I think it's really admirable if people are trying to do this on their own. It's very rare that they're gonna get it right. Um, and this is one of those things I really believe in outsourcing. I'm actually not a big outsourcer person, but in this case, with everything else they have going on, like that piece at least should be outsourced, just a calculation, because you want to make sure you get it right. And the worst thing you could do is go out and buy healthcare, offer it to people, spend all that money, and still get fined because you didn't offer it in the right way. So I'd say internally, that's one thing. From the IRS, you know, I, how they audit it, I don't know. That's a little bit of a black box. But what I do believe is, again, marketplace enrollment data is going to be the big piece, and they will definitely, see the one person that registered and get you for that Part B fine, and that might lead to them doing a little bit more investigation. And I believe maybe the revenue of your business, they can understand that an average home care agency would do this amount if they had this amount of employees, which means they should probably be supplying healthcare insurance.
Okay.
Yeah.
You have interfaced with, hundreds of home care companies at this point in time. I'm just so curious. I'm putting you on the spot with this. If you can quantify how many people are doing it themselves, not doing it at all, or doing it with maybe a non-home care specific partner, therefore probably doing it wrong. Like those are the three kind of camps that I see where if you could just kind of ballpark the industry in those three camps, where would you land?
I let me take a swing. I honestly think, sounds crazy, but maybe 20% of people have no idea that they are supposed to supply health insurance. That's probably about right. Like 20, maybe even 25%. I think, there's another smaller element of people that know and they're just risking it. And then I think you've got the large majority of people, in that 65 to 75% know they have to do it, are offering something, but maybe don't have the best like setup for their type of business. Like traditional group health plans, that doesn't make a lot of sense for caregivers. They're just not going to buy into it. It's going to be super expensive. They're not going to utilize it. And so I think, out of that 65, 75%, maybe 30 to 40% just don't really have something that fits a home care agency. And then out of that same group, maybe 10 to 20% are offering it but not calculating it correctly.
Okay. And
Yeah.
that bucket, are they probably working with like a local broker that's helping them kind of configure these plans? Who are they working with to do this?
All across the board, that bucket of people that are supplying healthcare, but, might not be like calculating it correctly. I would say they're either probably doing the calculation on their own or, sometimes I've actually seen them go and outsource it, and that's still wrong. So, and you might say, "Hey, how do you go and double check this?" It's a great question because if the company that's doing it for you that you paid isn't doing it right, that's a problem. Um, but yeah, I think the biggest issue is they're either just doing it on their own or they're not calculating it. They're just kind of randomly offering it to people.
Okay. And when you say outsourcing, just the calculation or the calculation plus, like would the broker or the company, like they do that calculation and therefore they give you the plans? Or do they, I don't know. I'm just wondering, are they doing the calculation? Because it seems like there's so much room for error in the calculation itself that even people that claim they're experts in this are likely doing the calculation wrong.
Could be, yeah. The broker is typically not gonna do the calculation. They're gonna set you up with the plans. Your payroll company, like you said before, might do it for you, but you might have to tell them to do it, or, buy, like, another module. So, most of the time, it's on you, and that's the unfortunate part about a lot of this. Most of this is on the owner. There's things like issuing benefit notifications. There's things like, eh, like filing the taxes, like all of these different things that you're expected to know and you might just not, right? So it's on the owner. Um, and they could just outsource that one part. They could just go and do the hours calculation, but if they're not doing it, nobody else is doing it for them, unfortunately.
Yeah, and that again is just a good reminder to everyone listening to this of like likely no one's doing this for you and so you need to do it yourself or engage with someone that's going to do it for you and do it right.
Yeah. And I've heard, actually I was on the phone with somebody yesterday, I think, where they said, "Well, hey, is it okay if I just offer it to, their one employee because I know she works really hard?" And it's like, that's great, but that's not the way it gets separated out, right? Or I don't want to offer it to this person because they're out sick a lot, so they probably don't qualify. It's like, well, that's great, but like you probably should do the math and make sure that's right because if not, the IRS isn't going to come and say, "Oh, they were sick a lot. Okay, no problem." They're going to come in and be like, "You didn't do this right."
These are the misconceptions. I actually wrote down a few. Let me share the ones that I came up
Yeah,
with, but
yeah,
I want to
yeah.
hear what other misconceptions that you have because there's just so many misconceptions and I not to knock on anyone, but it's like these are easy things that leaders could think and so we want to just kind of like
Yeah.
vocalize these. The ones that I came up with. We don't have many 40-hour employees. That's what people are going to think
Yeah.
full-time
Yeah.
equivalent. We don't have many 40 FTEs.
Yeah. Yeah.
The threshold is 30 hours, so let me just set the record straight, and then we already walked through the calculation, and so the calculation is way more complex, but on the surface, people may think, "Oh, we don't have many 40-hour employees." Second one, part-time employees don't count.
Correct. Yep.
Again,
Yep.
misconception, a
Yes.
misinterpretation of kind of like the jargon here, part employees don't count. Another misconception, we offered coverage once and so we're compliant, therefore we put something in place and just continuously we're compliant. They're not like revisiting it.
Right, and the
And
second
then the
part of that,
last
I was gonna say
yeah,
that one usually comes with, "And nobody wanted it or nobody took it, so we stopped it," is what we hear a lot.
exactly. I hear that all of the time. We offered it. Nobody took us up on it. Therefore, we just
We're
opted out.
good. Yeah,
It's like,
no, I've heard.
no. And then I guess just the last one I have is we're too small. Agencies think, oh, we only have 40 employees. Oh, we only have 60 employees. Like they don't understand the 50 and what that actually means. But like, oh, we're too small. Oh, we're only a $3 million company. Like we're not over that threshold.
For sure. That last one, it's interesting. We see kinda like, I would say like a difference depending on employee size. And honestly, when they're like 0 to maybe 10, 15 employees, they're often looking for something because they need to be competitive in the market to, get people on board. And so they might come in, even though they don't have to supply it, to get healthcare because they just need to go hire caregivers and they're very small. And so they need something to attract them. And then we see it kind of tail off from like that 15 up to maybe 30 employees. And then it jumps back up again when they start getting more towards that compliance frame. So Yeah, it's interesting. It really is.
Yeah, we haven't even talked about that. That's a different angle of, like, the
Yeah.
workforce
Yep.
and the labor shortage and how competitive it is out there, and offering this not just to check the compliance box,
Yeah.
but to offer this as an incentive and a benefit to your employees. And you yes, maybe speak to that of seeing this as something that, you have to check the box, but also as an opportunity to attract people.
Yeah, for sure. I mean, again, with turnover, what it is, it's like it's so competitive, and the caregiver market is very difficult, and finding people that like and want to hold on to is tough. And they'll go somewhere for quarter extra an hour or something along those lines. And so we do see a lot of agencies, especially when they're new, they come in and they are just trying to figure out how to get clients and how to get caregivers on board. And that's one of the things that they realize, okay, I need to do something to be competitive in the market. And so there's different variations of what that could be. You might not go out and supply them with a full boat healthcare plan, but there's other options that you can offer to them that are minimal. Doesn't cost the company a lot, but still gives them something that they can actually use. So it's yeah, I mean, it's a recruiting strategy for sure.
Yeah. Just a quick kind of recap of the conversation, Brendan. You're talking to all these leaders. They've just listened to everything that we just shared. What are like the, I don't know, 3 to 5 things that they should go out and do after hearing this conversation? We just kind of jogged through it all. What,
Yeah.
if you heard this and you weren't compliant, like what are the first 3 things that you would do?
So, one, you need to get a really good understanding on your employee count if you haven't already, and you need to make sure you work through that calculation to understand. Because Miriam, your first line was, we hear it all the time. We're just like, oh, no, I'm fine. I only have 10 full time employees. It's like, okay. So I'd say that. I would say second, if you're already offering something, I would just double check that it is compliant. And I would also double check that it's something that people actually want to use or can use that fits home care agencies. And again, one of the big problems is, if you got that same accounting firm I was referencing, right? They want really high level benefits probably. And that's expensive, and often caregivers wouldn't be able to afford that level of benefit. So you want to make sure that what you're offering is something that they can actually use. Um, and then you challenge me. A third one, I would say it probably goes back to that affordability. So if you are trying to be Part B compliant, and you have all your healthcare is purchased and you're offering it to everybody, are you doing it the right way? Are you subsidizing their healthcare if it's too expensive for them?
And I'll add the fourth. Look into Vitable. Let's everyone's listening to this. And granted, I came to you all like I think this is so important and just nobody should have to go through this. And you can all kind of like tease this, but you can share a little bit more. Joe, the founder of Vitable, his parents run a home care company and they were up against this exact issue. And that's where Vitable was born was, okay, we just went through this ourselves. Let's go out and help a bunch of other home care companies avoid this, learn about it, and then offer actual like programs that help with this. So that's kind of my pitch. But talk a little bit more about Vitable and what you all offer and why you've built things the way that you have for home care specifically.
Yeah, sure, 1,000%. It's funny. Joe's family still does own that home care agency, and so anytime we think we have a great idea, that's like the testing ground for all of our great ideas. So we'll try it out there, and if it doesn't work, we'll hear it pretty quick. And so Joe did have that vision. He saw that there were a lot of these caregivers that are taking care of our loved ones weren't being taken care of on their own, and what that meant was they would go out without health insurance. They would go to the emergency room for small things that end up costing them a fortune. They would not have the same life expectancy as people that were having healthcare. Obviously, it's not a great situation. And so he started the company building direct primary care, which was employer paid. They pay a small subscription price, and that employee gets all of their preventative doctor's visits, medication, lab work, mental health therapy and coaching, all of that taken care of, no deductible, no copays. They can just have the peace of mind of going and getting that preventative care, which ideally helps in the long run. And for the employer, also helps on sick time because they're not calling out as much. And so, built the company on that, and then really started branching out into a bunch of other ACA compliant solutions that fit home care agencies. Traditional benefits, like we said, often don't fit there. And along with this, we manage that compliance. So you get a really simple path to that. All of the stuff that Miriam and I were just talking about, obviously, it's really a lot. It really is. And so we are, built to, make sure we're doing that correctly. Um, and utilization. When people have Vitable, they actually use it as compared to a lot of these other healthcare plans that just don't get much utilization. So our goal is really to take those home care agencies and allow those people that are taking care of others to go and actually be helped themselves. So hopefully that gives you a little bit.
Yeah, and that's actually something I've heard firsthand is utilization with Vitable. And I think I draw attention to that because again, there's employers out there offering something and it may be pretty good, but like tracking utilization of benefits is really important to see if people are actually taking advantage of it. And Vitable is simple and understandable and applicable. Therefore, people are utilizing it. Therefore, as an employer, you feel like this is worth it, when you're just paying for something that's not being utilized you shouldn't be doing that essentially, or it hurts, a lot more. But this is like if they're actually using it and healthier and happier and their families are safer, like you almost can't put a price tag on that.
Right. Yeah. Yeah. No, you're dead on, and it really is. There's you can imagine the thing we actually didn't talk about is that when the ACA was created, you can imagine that what immediately followed it was what is the cheapest plan and the worst plan that will get me qualification for this, right? So all of these plans were created that were just built to fit compliance. And unfortunately, that's what a lot of people sign up with, and the plans are really unusable. And so because of that, you might be compliant, but your people are just sitting there going like, what is this thing? With Vitable, we can get you very compliant plans, but we also layer in that primary care that makes sure that people are taken care of.
And so to make sure people understand, you all like check the compliance box, but then you have all of these plans. So you all have gone out and built the relationships with these insurance companies and healthcare companies and like you've built all of this out and then you also have if I understand like the technology piece like the software like essentially you have the full package so people can come to you check the compliance box but build and choose the plans that they want and then you see through all of the like implementation and execution all the way down to the caregiver level, correct?
Absolutely. So for our primary care, we actually own the whole network. So those are all our providers. So that's all controlled by Vitable, and we have very high standards on who is servicing our clients. We work with partners for some of our other plans, but then also we are, and I don't again all the different layers. We're an ICRA administrator, which is something we do all in house, which is individual choice plans, where your employee can go out and shop many different plans across a marketplace. You give them an allowance, and then they use that to go and purchase whatever plan makes sense for them. So geographically, or if they've got certain doctors they want to see or certain things covered, they can buy the plan that's right for them. And then on a separate note, we do all the compliance. That's our own tools that we've built.
And you say some of it you all kind of like own and run in house. I guess that just kind of begs the question of like, are you nationwide? Are you only in certain states? Or does that ICRA kind of program help with being nationwide and that people can kind of pick and choose and it's more allowance based?
Everything is nationwide. Our primary care that network's nationwide. We can administer ICRA and all of our other plans in any state. So, yeah.
Okay. And just cost, can you throw out not specific numbers, but what people are paying elsewhere and then how you all kind of structure your pricing for this? Is it per head? Is it more of a lump sum? I think people just want to know like even how you compare to what they might already be doing.
For sure. Yeah, it's tiered based on the size of your business, and there's always two sides of the cost. There's actually like our fees, the administration fees, but then there's also the cost of what your employees are going to pay in premiums or their own costs that you would bill them back through payroll, just like whenever you've had a health insurance. So when you get charged by Vitable, you'll have those two costs. Our administration usually runs to give you like an average, we again, we charge a based on tier, but like an average employee per head cost is probably about $30 per employee per month. Um, with, but when they sign up for a plan, they might go and pay that premium, which the employee would be going and paying for. And if it's not affordable, you might be subsidizing that. So it's not Vitable cost, it's what you'd have to pay with anybody else.
Got it. And that's useful for people to kind of like cross compare what they're currently doing. I guess I'm a little bit naive. Is that similar to what they might be paying? Is that a lot more or a lot less to what they might be paying?
wildly across the board.
Okay.
It really depends on what they're doing today, and there's the tough thing about this industry is there's so many different options on what they could do, and if they have group health plans, that's probably very expensive. If they, are working through a broker, sometimes that can be really good, sometimes it can be really inflated. So, the best thing to do is always just get a second look at it.
Yeah, I couldn't agree more. Brendan, you've been awesome. This has been fantastic. I think you've represented Vitable well. I just want to put the plug in for you all are a wealth of knowledge, and I hope this conversation has demonstrated that. And so if you all of you listening to this are thinking like, oh wow, I really should get someone to kind of like double check my work here. Vitable's a great option to just go and have a conversation with to kind of look at your numbers, do a kind of a mini version of that audit, and then decide for yourself what next steps to take. But it's so nice to just have an expert like in your back pocket to go and bounce these things off of because again, this is complex, but it's
Very
extremely important.
yes.
And we want to help leaders avoid these very common pitfalls. And so we hope that this conversation has been kind of a step in the right direction.
This is awesome. Thank you, Miriam. I really appreciate the time.
Awesome. Just last thing I'll say, vitablehealth.com for anyone listening to this. It'll be down in the show notes, but connect with Brendan and the team there. And then also go to vitablehealth.com to learn more. And, don't be a stranger. These guys know what they're doing and reach out to them. So, Brendan, we'll wrap here. Thank you so much.
Thank you. Great talking.